John, so the specialty of women's health has really grown rapidly in the past 10 years. I know in Phoenix, when I started, there was only a few therapists, and now there are many therapists that specialize in women's health. I'm just curious about what got you into that specialty and what it was like when you first started.
Yeah, well, an interesting story that I had a very successful practice in Pennsylvania, and I had a lot of therapists that work with me, and we had a lot of people with like most of you have back pain, and some are having severe coccygeal pain. What we did wasn't that effective for the coccygeal pain and the pelvic floor problems. Um, and then I had a patient that showed up. He was an old osteopath. He's really a sweet old guy. And he had been an osteopath for many, many decades, actually. And he had retired. And um, so we decided to trade techniques. So he taught me manipulation, a lot of the osteopathic techniques, and I taught him some of the things that I knew. And we had a good friendship. And one day, this young lady came in with severe coccygeal pain. She could hardly breathe. She couldn't sit. Just her life was miserable. Of course, she had headaches and a lot of other associated symptoms. So one of the times I saw him, I asked him what he would do about that. So he explained how you have to go internally and free up the pelvic floor and then pull the coccyx back into its proper position. So I he sort of talked me through what to do. Then of course I added in the myofascial principles because the osteopaths manipulate and chiropractors manipulate the coccyx, but it's too quick. And then the pelvic floor just seizes up and again once you're back in gravity. So I started to apply the myofascial principles to the pelvic floor area and the coccygeal area. And this young lady, it was unbelievable, almost instantaneous, dramatic relief. She was so grateful. So as I continued to do this work, I realized how it was associated with so many of those symptoms in our body, particularly headaches. Remember, find the pain, look elsewhere for the cause. So many of the headaches, if you're treating the head and neck, it's not resolving, it's in the pelvis. And think about when you were a kid, how many times did you not fall on your butt? But that tightness remained, and you're very malleable as a child. But over time and the other traumas that occur to us, it catches up to you. Now the coccyx gets pulled forward. That is, pulls the coccyx and sacrum are so functionally one. They get pulled forward. The dural tube attaches at our second sacral segment. The dural tube pulls down. It pulls the vertebrae together, twists, compresses discs, and puts enormous pressure on the adjacent nerves and blood vessels and reach up through the foramen magnum. And it's the covering of your head. So it has a lot to do with the entire spinal problems, headaches, and just completely disrupts your physiology. It's really important work. Also, in a women's health seminar, it's for you. It's 4 days of incredible treatment, and then obviously things that you can do for your patient. Um, the A lot comes up about shame and guilt. A lot of people have had problems with their sexuality in the past. Their first sexual experience may not have gone the way they had hoped, or they were forced. Horrible things have happened to a lot of people. And all the talk therapy in the world, as well-intentioned as it is, this doesn't get anywhere. It's only when these memories come up, just like anywhere else in your body, as these memories come up that have been buried in the tissue for many, many years, and a lot of people, all of a sudden now you're freed of it. You finally can be yourself again. So it's incredibly important for men and women.
Um, when you started doing pelvic floor therapy, did you know of any other physical therapists that were also doing that work?
No, no, I didn't.
Okay.
The other people that are doing pelvic floor work, again, they're coming from the traditional point of view and they're treating symptoms, trigger point therapy, electrical stimulation, that type of thing. Biofeedback's very valuable as a adjunct to that also, because a lot of people have lost their ability to contract the pelvic floor, internal musculature. But unfortunately, I don't know her name. I wouldn't say it anyway, but she came to one of my couple of my seminars, and she was like nationally known pelvic floor specialist. We were talking about it, and I said something about internal work. She had never done or had pelvic floor work done to her. My God. But it's all about symptoms, so that there's be careful, make sure if you're going to have pelvic floor work, and most of us need it, whether we realize it or not, make sure you've been somebody that's learned true myofascial release.